Ozone therapy. How many of you have heard of this?
This is one of the most powerful at-home healing modalities that you can own.
It's a powerful intervention.
Hundreds of thousands of people every day are using something called ozone therapy for preventative care, treating chronic disease, or biohacking. In addition to that, most people don't know that thousands of doctors every day are also using ozone therapy in the US alone for chronic disease or biohacking. Sounds kind of bizarre, right? Well, most people have only heard about ozone for the ozone layer or as a pollutant. So why would we be using ozone gas in the case of serious chronic diseases or as a biohacking tool? Well, there's a very good reason for that, and let me explain it to you. But first, if you have a chronic disease, and I'm assuming if you're watching this that you're somebody with a chronic disease or you're looking to optimize your life, it's really difficult, right? Chronic diseases can range from cancer, Lyme, autoimmune disorders, whether that's arthritis or celiac or Hashimoto's, infections, liver diseases. The list is endless. There's all sorts of things that make life really difficult. You have to go around from doctor to doctor, spending lots of money, and not just money, also time that you could be allocating elsewhere. It's a huge pain to deal with chronic disease, and most people have been failed by the conventional way of doing things because they've been to 10, 20 doctors, and now they're in this space of kind of integrated medicine and just seeing what else is out there that the FDA doesn't necessarily tell us about or isn't necessarily utilized to its full capacity. And simply put, all ozone therapy is using a small amount of ozone gas, and I'm meaning like this much, not a whole lot, that can fit into a small syringe, and administering it to a part of the body. Now that can be the ears. In a doctor's office, they can draw out some blood and mix it with the ozone gas and then put it back in. Could be rectal insufflation, vaginal insufflation, not the most glamorous, but actually have a lot of research and can be really effective. So here is one of my favorite testimonies that I've had over the years, and a big portion of why I do this work. I believe from a mission standpoint that my job is to alleviate suffering in the world, and I had a passion for healthcare since very, very young, so it's something that I'm really into. But here's Amber talking about her experience with ozone therapy.
My name is Amber, and I had a stroke 16 months ago. It was a massive stroke, giant clot right up in my brain, and it went through the Broca area, which means all my vocabulary, all the English language, writing, reading, even math problems. I have a really hard time doing math problems, and my entire right side of my body was paralyzed. I've been doing ozone treatments with the UBIs, and it's made a huge difference. When I got out of the hospital, I was supposed to be in for 2 months. I got out in 6 days and started doing ozone therapy immediately. So I've been doing it for 16 months. After about 2 months, we went to a clinic in California and did a SPECT scan, and they said that I was showing signs of having had a stroke 2 to 3 years before instead of 3 months before. And they want me to come back after a 2 years to the day when I had the stroke, and they want to do a case study on me because I can talk. When I do ozone, my vocabulary comes back.
And if you go online, you'll notice dozens, hundreds of reviews just like this on ozone therapy that are showing the benefits of it, how it helped the person, what they were facing, what it did for them. A lot of times you'll hear people that have done so many different things and then they do ozone therapy and it's helpful. And I'm not trying to make this sound like a silver bullet. I'm all about educating and just giving people the ability to make an informed decision. But I do want you to know about this because it can be such a helpful tool in the toolbox. Hey, my name is Micah. I'm known as the Ozonaut, and I'm one of the people responsible for training tens of thousands of doctors in the US alone on ozone therapy, and not just myself, our entire organization. We've worked with names such as Dave Asprey, Ben Greenfield, Dr. McCullough, Reardon Clinic, Hope for Cancer, and many, many more. And we are one of the primary education sites and materials for this therapy called ozone therapy. There's actually over 2,000 medical studies on ozone therapy, and if you're a research nerd, you can dig into those, and we'll have those linked right below this video. So when we're talking about ozone therapy, what does it actually work with? How is it going to benefit you? How does it benefit me? Well, there's a couple of things that we already talked about. If you're in the chronic disease cycle, ozone therapy can help with that. If you're just looking to optimize or prevent reoccurring illness or just prevent illness altogether, I'm not saying it's going to be perfect, but it's definitely a helpful tool to have in your toolbox. Ozone therapy helps these things by balancing the immune system. So what that means and why it can be used with autoimmune patients as well as cancer patients is an autoimmune person essentially has a hyperactive immune system, right? It gets really high and then the immune system begins to target the body and deteriorate it. That's when your immune system is hyperactive. On the other side of it, you have immunosuppressed cancer patients who just don't have the immune system that they should have to fight off infections, to fight off things. And this can be a lot of people, not just people that have cancer or are going through chemotherapy. But immune balancing means that if it's too high, it's quieting it down. If it's too low, it's bringing it up. So it's not just an immune boost. The other thing that ozone therapy is working with is increasing oxygen efficiency. So that's how well we're utilizing oxygen. This is why athletes like it. This is why biohackers like it, because it clears up your head so you don't have nearly as much brain fog. Your stamina is increased. If you're somebody who is sick, you generally will notice a big increase in energy, things of that nature. So oxygen efficiency is super important. The other thing it works with is an anti-inflammatory. So inflammation is a huge part of disease, huge part of aging. If we can reduce the amount of inflammation that's happening, and inflammation can be healthy to a degree, but chronic inflammation or inflammation that you don't want there, we want to get rid of that. The other thing it does is it improves blood flow. So blood flow we don't really think about very often. It's not something that a lot of people consider unless you have a cardiovascular issue. But blood flow is actually very important because it does something that's called gas exchange or nutrient exchange. As your blood flows through the different parts of your body, it's going to be able to pass off nutrients to that needed area that previously was not getting it. And it's also able to take the garbage and excess that the body built up while it was doing the functions it's supposed to. And the final thing that it primarily does is it mitigates that oxidative stress cycle. So we listed off a lot of different things, and usually my red flags go off when I hear that something can be used for this, that, and the other, right? Because it just sounds unrealistic. But when you understand ozone therapy, you understand that it's not just doing one or two things. It's not just flipping a switch on or flipping it off like a lot of drugs do. It's actually working on a very fundamental level. And when you're considering aging, the aging process, or chronic disease, we can boil those down, not entirely, but there are two fundamental things that are perpetuating that cycle of being sick or aging or declining. And those are oxidative stress. Well, let me phrase that. Chronic oxidative stress. That's a very important thing to know. Chronic oxidative stress, which is basically when your body has too many free radicals. Free radicals in moderation are actually very positive. You don't really need to understand the biochemistry and exactly what they do. But free radicals in moderation are very good because they promote cell signaling and communication and allow your body to work properly. However, chronic oxidative stress is talking about when there's too many of them. And what do? They begin to damage cells. They begin to throw wrenches into the system. So chronic oxidative stress is one of the primary culprits, and this cycle that just keeps on going, whether you're sick, you're aging, you have brain fog, whatever it is, chronic oxidative stress is at the base of that. The other thing is oxygen efficiency. So when we're born, we're at our height of oxygen efficiency, and as we age and all the way up into our death, we're at the lowest point of oxygen efficiency. So this is not talking about deep breathing or breathing really well. That's just the amount of oxygen you're breathing in. But there's actually a very important cellular function that's happening when you're breathing in oxygen. And not all of the oxygen that you're breathing is necessarily utilized well. This is something taught by Dr. Frank Schallenberg that you can go and look up. But essentially, you see that the oxygen we're breathing in is not being used for metabolism and very important functions for the body. Rather, it can actually cause damage. So what can we do to mitigate the decline of oxygen efficiency as we age or are sick? So these are the two fundamental things that perpetuate the cycle of chronic disease, aging, all those kinds of things. Oxygen efficiency and chronic oxidative stress. So you might be wondering why I'm on here talking about ozone therapy and the benefits about it. Well, think about ozone therapy as a stimulant, not in the sense like caffeine, but what it's doing is it kind of slaps your body awake. Now think about when you wake up in the morning, what do you use? Typically, people use an alarm clock. Now, the alarm clock wakes you up so that you can get up and going about your day. Ozone therapy is pretty similar in that. It wakes the body up so that it can function the way that it's supposed to and bring it into homeostasis. Now, I know homeostasis is a common word that people use. All it means is that your body is balanced out. It's not this big, complicated thing. A healthy person is typically in homeostasis. So you want to be in that situation, because when you're in homeostasis, it means that your body is able to take on infection, sickness. That's why people who are really healthy don't get sick, right? Because their body is just performing as it should. And so ozone therapy is stimulating us to that point where our body should be performing as it should. And what are some of the things that people are commonly experiencing when they do an ozone therapy? Improved circulation, feeling of wellness, reduced chronic cellular damage, mitochondrial and metabolic support, increased stamina, improved energy, reduced brain fog. There's antiviral, antibacterial, antifungal properties to ozone. Often they feel reduced pain and improved cognition. These are just some of the things that people experience. Some of these come from a scientific standpoint, some of these come from an anecdotal standpoint. I just encourage you to look into ozone therapy and read some of the stories out there. But what exactly is ozone gas? Like I said, you might have heard about it because of pollution, because of the ozone layer. Well, those have ozone in them, but it's not the same thing that we're talking about here. We're talking about pure medical grade ozone, which is a pure form of ozone and oxygen mixture. So ozone is very similar to oxygen, the oxygen we breathe in, O2. Ozone is O3, which means it has 3 oxygen atoms. However, ozone doesn't really like to be in that state. Ozone has the 3 oxygen atoms, but it doesn't want to be there. It wants to detach one of the atoms and revert back into oxygen. This is called oxidation, and it makes it a very, very powerful oxidant. So as you can see in this video, ozone is extremely unstable, and that's why when you're using ozone gas, it's important to have equipment that's all ozone compatible, meaning it's not going to be affected by the materials, but there are certain materials that cannot be used with ozone. So let's take, for instance, the lungs. I know this is an extreme example with the latex glove, but when you breathe ozone in, it's actually going to be interacting directly with the lung tissue because there's no antioxidant defense there. However, in other parts of the body, such as the rectal or vaginal or blood, insufflations, there is an antioxidant defense system, meaning that the ozone is going to react with the antioxidants and it's not going to actually harm the materials that are there. So you might be wondering at this point, why would I be using something that's such a powerful oxidant? And didn't you just say that oxidative stress is bad? Well, I said that chronic oxidative stress is bad. Actually, acute mild oxidative stress can be really positive, and there's some other examples in life that I'll show you that you are constantly stimulating mild acute oxidative stress, which actually rehabilitates the body so that it can fight the chronic oxidative stress. Can you guess some of the positive forms of oxidative stress that are very, very common? Well, one of them is exercise. Every time you exercise, you're stimulating a mild acute oxidative stress. Your body undergoes a small amount of stress and builds up stronger because of it. Or when you're fasting, fasting stimulates a mild acute oxidative stress, making the body healthier, making the body stronger. Cold plunges can actually stimulate a mild acute oxidative stress. So these are all forms of mild acute oxidative stress that we're familiar with, but don't necessarily look at as unhealthy. And ozone therapy is doing very similar things to these. It's not a replacement for exercise or fasting or cold plunges, but it's stimulating that same pathway of mild oxidative stress that will notify the body that it needs to be healing, that it needs to get up, and it needs to get moving on the things that it's supposed to do. So let's just take a quick look at, these are just a few examples that I pulled off of the internet and some of the studies that I looked at, but let's take a peek at this one. So this is heart disease in rats. You'll see 3 pictures on the screen. Those are hearts. Yes, those are all hearts of a rat. And on the left, you'll see that that's the sham group, which essentially means the control where nothing was actually done. And you can see the heart is not looking so good. The IR group is actually, they're doing some infrared light on the heart to see what it does. And then they did a combination of infrared and ozone on that third heart there. Can you guess which one performed the best? I mean, the one all the way on the right is the only one that looks recognizable as a heart. So this study shows the prevention of heart disease in rats by preconditioning with ozone therapy. And they claim that this is due to its ability to attenuate mitochondrial damage. Here's another case. This is a case study by Dr. Rowan, and this patient was unfortunately suffering from pretty severe autoimmune disorders. And he was able to get this result exclusively using ozone therapy, and it, as you can see, greatly alleviated this gentleman's issues. Now, this might be a little bit gross. Maybe you don't like feet. Maybe you don't like some of the gross pictures. I'm sorry, but I just want to show you. And again, these are some examples. There's hundreds, thousands out there that you can go look at, but these are just a few. From ozone therapy, there was a huge reduction for this patient in necrotic tissue due to the lack of blood flow and inflammation of blood vessels. So essentially, this patient had necrotic tissue, and as you can see, from the ozone treatments alone, improved blood flow, improved oxygen efficiency, that necrotic tissue is starting to heal up and go away. Ozone therapy is a biohack, so you might be familiar with some of these guys. Maybe you are, maybe you aren't, but essentially they're just trying to live as long as they possibly can at the best quality of life. So we have Dave Asprey here. Ozone is a powerful tool for decreasing oxidative stress body-wide, making it an ideal way to slow down aging. That's Dave Asprey, the founder of Bulletproof, the father of biohacking, New York Times best-selling author. Then we have Ben Greenfield. Right now I'm trying a multi-day stint of my friend Dr. John Lawrence's ozone treatments for the ultimate mitochondrial cocktail. The results thus far are promising in terms of overall daily energy. That's Ben Greenfield. And third, a lot of you probably know this guy, Dr. Joe Mercola. Ozone therapy is a powerful intervention, and if you've been paying attention to him lately, he's actually been very big on an ozone therapy called EBOO. So those are some very common faces in the biohacking realm for ozone therapy. And if you're not familiar with those guys, you might be familiar with Dr. Mark Hyman, who is the father of functional medicine, and this is what he has to say about his experience with ozone therapy.
Well, I just want to share a little bit about my experience with ozone because a number of years ago, as many of my listeners know, I got very sick. I had a root canal that went bad. I had to take an antibiotic called clindamycin, which caused an infection known as C. difficile or C. diff, which kills about 30,000 people a year. It didn't kill me, thank God, but it did cause severe gastrointestinal symptoms and led to colitis. I also broke my arm at the time and had a lot of anti-inflammatories for the pain. I didn't want to take narcotics. I was taking Advil and Aleve and ended up having total GI dysfunction, just gastritis, colitis. That led to me to lose 30 pounds. I was vomiting all the time. I ended up, just driving an autoimmune disease. And I felt like I was in a cytokine storm. I literally felt my entire body. As a physician, I understood what was happening. I felt my whole system just break down. And I was struggling as a functional medicine doctor to recover using all my normal tricks. And I knew about ozone because many of my patients had used it and reported that when nothing else worked for their chronic illnesses or chronic fatigue or Lyme disease, viral infections, that often ozone would help. And so I did a bunch of research and I found a practitioner and I started to do ozone therapy. And I had complete brain fog, complete exhaustion, fatigue. My gut was a mess. I was going to the bathroom 20 times a day, bloody diarrhea. And then within 2 days of ozone therapy, my brain cleared up, my energy came back, my colitis went away. It was pretty shocking. And if I hadn't experienced it myself, I wouldn't believe it. Now that's just an N of one. It's one case. But I have been using ozone therapy with patients and seeing the results. And often when other things fail, it works. And it's definitely a hurdle for people to get over mentally because it seems like ozone's dangerous. It's a gas. We hear all these bad things about it, but it's actually extremely well researched. It's extremely safe. And it has the potential to help solve the biggest pandemic in 100 years. And yet it's almost invisible in the conversation.
So how is ozone therapy actually applied? I mean, we talked about some of the basics of it, but how is it actually administered to the body? Well, you basically have your options of doing it at the clinic or doing it at home. At the clinic is a great way, especially if you need a recommendation from a doctor or if you're facing a tough chronic disease, doing some of the blood treatments can be really good. But essentially at a clinic you have MAH, 10-pass, high dose, and EBU. You don't need to know what those are, but they're taking out some blood, mixing it with ozone, and putting it back into the body. Then there's joint injections, there's beauty care, and there's dental uses, all of which are going to be at the clinic. Now at home, however, you can do ozone therapy for under $1 a treatment, very inexpensive, very easy to do, only takes a few minutes each time you do it. And there's two different categories. Essentially, there's ones that give the entire body a benefit, so that's stimulating the entire body to respond better to whatever it's facing. And those include rectal insufflation, vaginal insufflation, and drinking ozone water. However, I do want you to note that drinking ozone water is more anecdotal, meaning that it's just people's experience. There's not really the scientific evidence to show that ozone water is actually doing anything beyond stomach infections, but there really seems to be a lot of people responding well to it. I'm not sure why, but I just want to give that information to you in case you're interested in it. And again, this is using a medical ozone generator using pure oxygen from an oxygen tank. This isn't the ones that are putting out a very low dose of ozone into ozone water, just drawing in ambient air. You can't use those. Local area benefits, meaning that's just going to benefit one area of the body. So if I put it into my ears, it's not necessarily traveling throughout my entire body. It might help some with the sinuses, might help with the eardrum. But if I have an ear infection, if I have a sinus infection, ear insufflations are a great way to do that. And we also have ozone water for the mouth, for the skin, limb bagging, which is for diabetic ulcers, MRSA infections on the skin. Then we have an ozone sauna, we have ozone oil, and then lastly there is breathing ozonides. This is not the ozone gas. This is when you bubble it through an oil, it converts into something that you can breathe in, which is not the ozone gas. It's an ozonide. So that's very important to note. All right, so I gave you a brief overview on ozone therapy. I just wanted to kind of give you some education surrounding it. This is not comprehensive. However, if you are interested in ozone therapy and wondering if it can help you, I recommend downloading our guide to ozone therapy if you have not already. So go to drzozone.com/guide and download the guide and take a look at it. It'll walk you through everything you need to know about getting started with ozone therapy. And in addition to that, I'm going to link all the videos walking through how to do ozone therapy just below this one. So it'll tell you like how to do rectal insufflation, how to do ear insufflation, what even is ozone therapy in more depth than we talked about in this video. But that's all the information I have for you guys today. Thanks for watching, and I really hope that you find health with ozone therapy.